It's a great honor to be here. The business of pain is important, and for neurosurgeons, there's very few of us speaking here, and I think it's important to understand that we're in this together. And part of it has to do with what my topic of my presentation is, because in preparation for this, I knew that there'll be other talks about neuromodulation, and surely enough, there was plenty of information already about neuromodulation at different levels, including what we use for treatment of head and face pain. The idea here is that, in as much as we are interested in delivering proper modalities for the patients, it's very important to understand what exactly we're treating. And I was impressed with Dr. Day and Dr. Argov's presentations, because they spend a lot of time explaining what kind of best indications are for the procedures that can be used in that situation. Different kinds of pain require very different treatments. And